the first shock, the weather shock. After that, there was a lot of unlearning and relearning. So, unlearning of things that I would never have thought I would have to learn again, like using a zebra crossing for crossing the road. In India, we don't use zebra crossings. We just cross wherever we can. We'd sometimes stop the vehicles and cross the road. Pedestrians are the kings of the road, so you can cross anywhere. And then the other shock was how quiet it was. I could hear my heartbeat. I thought something was wrong with me. The place was dead quiet any time of the day. You don't hear people talking to each other. You don't hear the honking of the horns, which is something that is kind of lullaby to us in India. We can't sleep without hearing the honks. You can't hear the barking of the dogs. What is this?
Hello, everybody. You are welcome to today's episode of the Maverick Med podcast. And I have with me someone I will be introducing briefly as just Luby. And I'll allow her to do the heavy lifting by telling us who she is and what she does.
Well, hello, I am Lubu, as Hannah says. My full name's Lubaina, though. By profession, I'm a doctor. I work in intensive care. I'm an intensivist who's had almost 15 years of experience now. Initially trained in India as an anesthetist, and then changed my pathway into critical care because anesthesia was getting too monotonous and boring for me. So in the search for the adrenaline rush, I then found myself doing a fellowship in critical care. Then I happened to get married to somebody who lives in the UK. So without much planning or research, I just took the call and moved myself to the UK. And have been here since. It's been almost 8 years now and have had all my fun.
So we're going to unpick that introduction and she'll give us all that information that comes up together to where she is now. And thank you so much, Lou, because she is actually on holiday and she still managed to come through for us. So I really appreciate you giving us your time.
My pleasure.
So tell me, what does intensive care mean to you?
I think if I was to summarize intensive care in 2 words, it's medicine with passion. So for me, being a doctor was a dream for a very long time. I think as far as I know, when I was 4 or 5 years of age and saw my surgeon parents work really hard, set up their own nursing home in India and literally work their way to the top, I was super inspired by them and I always wanted to be a doctor. So I followed in that pathway, and then 15 years of really hard studies and somehow cracking all the toughest medical entrance exams in the country, I made my way into medicine. And I think since then, the choice of which specialty to take was not a very hard one for me. My parents, because they are both surgeons, I was thinking about going into general surgery, following in the footsteps of my dad. But the day when I was supposed to go and pick up my specialty, I don't know what happened. And he suddenly said, well, if you want a nice work-life balance, why don't you go and try anesthetics instead? And it was just a very random thought. I was there outside the counseling hall and I just changed my mind out of nothing and said, well, yeah, let's go and try that. And I just went in, chose anesthetics and never ever looked back. So in India, how it goes is you do your residency in anesthesia and then you super specialize in intensive care. So I've had like 3 years of the most rugged, intensive training in anesthetics in India. And following that, I joined my first job and I absolutely hated it because the way you are trained is very different to the way you go out and work in a private setup as an anesthetist. It was super boring. So I know I'm going to offend a lot of people by saying that anesthesia is not boring, but for me, it was personally really boring. So then I thought it was I think it was an opportunity given to me by chance where I went on to do a registrar role in critical care, and I absolutely loved it. So 6 months on from there, I sat for another very high level super specialty entrance exam for critical care and somehow made past it. So then off I go to Bombay for the next 2 years, which were going to be the fun years of my life, practicing critical care, learning all about the specialty. So I think for me, it was all about passion, and I've never looked back or regretted anything that I've chosen so far. Intensive care is something I love, like really love, in the most passionate religious way. And if given a chance to go do anything else or anything over again, I'm still going to take anesthetics followed by intensive care, which is like the thing for me now.
Goosebumps when I heard you say, I love in the most passionate and religious ways, because I hear people talk about how they love their work, but yes, I can almost feel the love that you have for this career path. Right, let's go an easy conversation. Take me back to your childhood. Mom surgeon, dad surgeon. Did you grow up in the hospital then?
I did, yes. So my mom's a gynec and my dad's a surgeon, and theirs was a love story. So I'm a love child.
Oh.
They both grew up in the same city. They did their medicine in the same medical college. They had a love affair for 5 years before my dad could convince my mom's side that he wanted to get married to her. Fortunately, they belong to the same religion and the same caste and the same, category of people, and it's quite important in India to just marry in the same community. So luckily they were in the same community, they fell in love, and then there I was born. And yes, I think after I was born when my mom was still in her final year of her gynae MD. So she was still doing her postgrads. The first year of my life, she was working like really hard. So I was being brought up by my auntie, who is no more, and my grandmom, who is my maternal grandmom. She's no more as well. So those are the people who brought me up in the first year of my life. And then we moved places, and my mom and dad, they took a huge mortgage and built up a hospital. So in India, you can build up your own private hospital and run surgical specialties in it privately. So they built up their own hospital, and then it became a general hospital which took both gynae ops patients as well as general surgical patients. So my dad used to do all the admin bits of it. He used to run his surgery as well, but most of the clientele was from my mom's side. And I grew up playing with test tubes in the lab, getting jaundice myself, getting all sorts of slides, my hands dirty in urine and poo and all those kind of shitty stuff. I was friends with all the lab technicians there, and I used to love working in the lab. And sometimes I would sneak out into the no-go zone, which was the labor room operation theater zone on the second floor of the building. And I wasn't supposed to go there, but I would sneak my way in and go and watch things happen there.
Lubu, were you an only child?
No, so I've got a sibling who's my younger brother. He's 5 years younger to me, but he's
So you had
absolutely
lots of the
wonderful.
fun before he joined you.
Oh yeah, yeah. I've almost had all the fun before he was born, because after that life completely changed. I was like a mom to him. So, and I'm still I think I am. I don't know. But yeah, I've had all this fun before he was born, and after he was born, because I took on the role of caring for him when my mom and dad were not around. I think I started going less into the hospital side of things and doing less of the lab things that I used to do before. But yeah, I've had my fun. I think it was from a very early time in my life that I decided this is what I want to become and do, and the respect that they got, the kind of people that would come to them to thank them for, the babies that were all then grown up and used to come and see my mom and say, well, we were born on your hands. I think that was one of the best things that I've ever witnessed. So I just wanted to follow through into their footsteps forever.
I'm thinking that I've heard people who said, I don't want to touch a medicine even with the longest stick because both parents were doctors. But for you, you have a totally different experience.
My brother is the person who would say that to you. He absolutely hated medicine. And while he was growing up, he was not enjoying the experience of living with two, surgeons and somebody who was like me, who was totally involved in getting into medicine. So I think if you ask him even now, he'd be like, absolutely not. So, yes, I think my experience also comes from the fact that I was the only one with my parents at that point of time, and we were quite close knit and we kind of supported each other quite a bit. And I saw them talk about things at home, bring their work to the dinner table every day. And they were not always bad stories. There were some really good stories, and they would never tell us the struggle that they were going through, but they would always come and tell us things that inspired us and things that really stuck with me for a very long part of my life, and the things that probably helped in growing my interest in medicine. And my dad was very keen on me becoming a doctor initially, but after I finished my, so we've got two high school levels, class 10 and class 12. When I finished my class 10 and when it was time to choose a specialty like science or arts or commerce, my dad was absolutely sure that I should not become a doctor, and then he started pulling me back from it. I was so stubborn by that point of time. I said, whatever you may say, whatever you may have faced, I still want to become like you. So I just carried on.
Is your dad still alive?
He is, yes. Both my parents.
Does
They're
he
still
know how
working.
much you hold him in high esteem?
Yeah, he absolutely knows. He knows that all that I've become today is thanks to them, and they're bringing me up in the way that they have.
Lubu, I dare say that you were a spoiled child. Would you agree?
Yes, a little bit. I wouldn't say no, and I still am.
I
So,
appreciate your honesty.
so if you meet my parents ever, you can tell right by speaking to them about me that they would spoil me in whatever way possible. Even now, I might be approaching 40, but they would still spoil me the same way as they used to do when I was 4. So I have been really spoiled. Like, I don't remember anything that I asked of them and that they didn't manage to get for me or do for me. Although, I have to be honest, I wasn't a very demanding child. I was very compromising, and I wouldn't ask for things that usual kids would ask for. I was very happy with a pen and a sheet of paper. I mean, that was probably the most I would play with. So I've done my part as well to deserve that little spoiling from them.
You do come across to me as a very confident person. Did you have a lot of early exposure to books and things like that?
So I've had a lot of exposure to textbooks. I am not a fan of reading novels, which is
Oh.
why I've got a whole pile of books at home that I don't read.
What's the Japanese word for it? You said it.
Ndoku is the word for it. And it's true because I collect books, but I've hardly ever read them. So for me, I think more than books, it was the practical learning, and then seeing my aunts, my maternal grandmom, and the other ladies in the family, my mom included, seeing them do things their way, seeing them find their path across a very difficult to live in community, seeing them be the rebellious people that they were, and still keeping the simplicity, keeping the humility, keeping the modesty in everything that they did, being really honest and being really helpful and kind to people. I think I've had exposure to all of those things throughout my life. So I didn't really need any books. I've had stories told to me by my uncles, aunties, my mom, my dad, my grandparents. So I never really needed books to be read to get the confidence or to, get an idea of how the world works. I've seen it firsthand. And I am very observant in that way that I pick up on things really quickly. So I'm also very quick in judging people. I just need one meeting to judge people and I can make up my mind about them. I'm not
My
judging
God.
you, sorry.
Now, tell me how you met your husband.
That's a very long story. I'll make it short for you. So it was a conspiracy by my mom.
Okay.
We didn't know that we were being set up because that was a point in my life where I'd made up my mind that I'm going to stay single. I was in Bombay. I was having the best of life ever. I was enjoying myself, roaming around, eating everything I wanted, not saving a single penny, spending everything that I was earning. And it was a fun life, and I did not want to give that up. And I've had a few crushes and other things in the past, but nothing had ever worked out. And I'd met all these people through matrimonial meetings who I thought were really dumb, and nothing could impress me. I was in a league of my own. So I wanted somebody who was very simple and who would just accept me the way I am. And most of these people who I was meeting, they wanted some part of me to change, to become eligible for them, which was absolutely bonkers because I would just never go for that. So I told my mom and I'd warned her that if she speaks of marriage once more, that I'm going to leave home and never come back. So they stopped talking about marriage. And then one day, suddenly, so I had an uncle, it's my mom's sister's husband, who was very close to me. He's no more as well. But he was like a best friend who was not related to me by blood, but he was like a father to me. And I would tell him everything, all my secrets. He would tell me everything about him. So he just suddenly one day said, well, I've got an email address for you, and I want you to talk to this person on an email. Just drop him an email and see how it goes. He didn't say it was a matrimonial meetup or something. He just said, this is a person I found, and if you would like to, just email him. So I emailed him, and my husband, we had a couple of emails exchanged, and then we exchanged a bio data and things. And the fact that I sent him my most miserable pictures and he said just one line, a happy face in all of them. I don't know what happened, but that was it for me. I was like, this is the guy I want to pursue now. He sat there in front of me. Um, this is a story I've told so many people now. And that was enough for me. I didn't need anything else. Like, that was that one line. I still remember it verbatim. And it's like, that's it. This is the guy. But then again, I was not thinking about marriage at all. So we just exchanged a few emails and then we went on to Skype, started talking with each other. He was very clear from the very forefront that, I'm not here for chit chats. This is a serious matrimonial business. So if you are happy to move to London as opposed to me moving anywhere, we carry on this little chit chat. Otherwise, let's just stop. And that was super mature for somebody I've ever spoken to. Nobody had spoken to me that directly ever. And I was so wildly gone. So then we started Skyping, and I was still doing my fellowship in Bombay. I would Skype him from the ICU room sometimes, and the nurses would be around and they'd be, hovering around. Who is she talking to and why is she so happy? And they mostly seen me really grumpy, but now I was completely a changed person while speaking to this other person on Skype. So yeah, that happened. And then we kept on talking for a few months on Skype. And then he was in London, I was still in Bombay. So we thought of meeting. And that was the first time we met. And we didn't meet in our own city. He was actually from my own city, but we didn't meet in our own city. We went to Kerala, which is the southern part of India. It's God's own abode. It's a beautiful, beautiful place. So we did our first trip together. We came to know each other a little bit more by living together for 5-6 days and had lots and lots of fun. And then we decided, yes, let's get married now. And that was the time when I went home and told my mom that, we've decided to get married. I was talking to this guy, and she was like, well, thank you very much. Why are you thanking me? She was like, I was the one who set you up. Then she spilled the whole story. And oh my God, I was so shocked that I actually fell prey to it. So yeah, I think that was probably the best part of my life and the best decision that I'd ever made. I was the one who proposed him. He don't even remember proposing me. I don't think he has till date. But yeah, that's what our story was. That we had a very nice destination wedding with whole pomp and show and glamour of an Indian wedding for 5 days around New Year's Eve in 2015. And we've been together since. I think we're doing okay.
Lubu, so this question came as an offshoot of you saying that you're a great judge of character. And I haven't known you for long, but I can see that you're really happy with your husband. That's why I asked you, where did you meet your husband?
Dare I say no?
And yeah, since you claim he didn't propose and you're on a holiday, hint. Maybe he can take advantage and say, I proposed to you in Italy. So, yeah.
I am going to tell this to him now.
And talking about Kerala, I've never been to Kerala, but I've been to Kerala vicariously through books. It's a shame you don't read, but there's this author. His name is Abraham Van Gees, and he is an Indian doctor.
Mm-hmm.
He's a professor in Stanford. So he's an international medical graduate. He went to medical school in India. And he's authored this lovely book. I think it's called, I don't remember, something about water. But he gives a picturesque description of Kerala.
Yeah,
And whenever I close the page, I'm like, I have to go to this place. I
you
have
have
to go
to.
to this
I mean,
place.
I do read. The only caveat to me reading a book is it should have pictures.
Oh, come on.
I'm a fan of graphic novels. I'm a fan of illustrated books. You know, The Boy, the Mole, the Fox, those kind of books. I do read a lot of them. I can't read a lot of theory. My attention span's just 12 seconds. So if you need to really get me reading something, I need a picture in every page. That's how I read
Now,
books.
how did you survive medical school?
I think I did well actually because I used to write down everything. My notes would be thicker than the Harrison books. I would have notes on everything. And because I was such an avid writer, I think I never missed pictures in those books. I was a very huge mugger as well. I could just about remember everything, like pages, and my visual memory was really, really good. So I would just remember what chapter, which page, which paragraph, what to write. I don't know how I survived medical school.
So you do have this dynasty in India, and for love, you move and come to England. Gosh, things we do for love. How was your first job? Did you have to take the plab, the out, or did you just find a job? How was your journey?
So, as I said, I mean, when I got married, there was still 3 or 4 months left of completing my fellowship there. And because I didn't want to delay it too much and I wanted to come and be with him as quickly as possible. So I did no research whatsoever as to how can I get into the UK and what will I do and what the future beholds. And I just took the leap of faith and came here. So initially, I think the things that I did was an IELTS, which was a journey of its own. I think I've written a long LinkedIn post about it as well. It was horrible. I had to take the academic IELTS to sit for PLAB, and then I had to take another IELTS to get my visa through.
But
I
you
put on a
speak English quite well. So
I
what was your
know.
struggle?
I was not struggling with the English. I was struggling with the fact that they wanted me to sit for IELTS 3 times because they were messing up my results. So it was quite daunting. And then once I cleared it, my academic result was 9 on 10.
Okay, wait a minute. We are interested. What happened?
So the first IELTS that I took was an academic IELTS because that's what you need to sit for PLAB 1. So I took that and I cleared that. I got a 8.5, 9 on 10. And then I sat for PLAB 1. And then I thought, because I've got such a good result in academic IELTS, I can use the same IELTS to then get a spouse visa to the UK. But hey ho, it doesn't work like that. So what happened was you're supposed to sit another kind of IELTS, which doesn't need you to score more than 3 or 4 on a scale of 10 to then make you get a spouse visa. That was the most stupid thing that I've ever heard in my life because
I concur.
so they made me sit for it. I sat for it, I cleared it, and I knew that I had cleared it. And then when it was time for the results, they said there had been a technical glitch and my results had been declared null and void. And they would then give me another date to sit for the same IELTS again and not take a fee for it. But they didn't realize that I was working as a critical care physician at the point. I had really daunting shifts to cover, and I couldn't get so many leaves in between to go and sit for random English testing exams. I had my own exams coming through. So, anyway, because I was so madly and deeply in love, I went through the trauma. I gave the IELTS a
And for
third
the
try.
guests who don't know, her husband is sitting close to her. So
He's laughing. But this is the thing. I mean, I sat for it the third time. I again obviously cleared it, and I saw no purpose in doing that IELTS, but I just went through the whole process. I sat for IELTS, I cleared it, I got my visa, and then I came over here. After coming here, I had the most, I would say, it wasn't even equivalent to a nuclear bomb. It was the shock that you can never imagine you will get. It was a mix of cultural shock, financial shock, people shock, and I was newly married. So, in laws shock, living with a strange person shock, crossing streets on a zebra crossing shock.
right, so let's unpick it. I know you had shocks from everywhere. I'm glad you made it. But let's unpick it. Which one do you want to talk about first?
Right. So I'll speak about the things that I wasn't used to. So I'll compare, and I've done this a few times. I've also written a little article for BMA about this because they wanted to know how my experience was different as compared to India. It's too different. These are two different parts of the world. They're like polar opposites of each other.
For apples and oranges, isn't it?
Exactly. They're like,
You can't compare.
you cannot compare them, but still I'll compare. So I had come from a place that was 40 degrees in April to a place which was 4 degrees when I reached here on April 22nd, and there was a forecast for snow in April. So that was the first shock. And my husband was stood there with this 20-kilogram jacket for me to wear. He thought as soon as I step out of that airport, I'm going to freeze to death. And I would have, because I was not carrying any jacket. My whole life, I'd not worn anything more than, I'd say, a very thin cardigan. I'd almost always been close to the sea. So there was never a peak of winter or temperatures less than 15 degrees anywhere. So I was not used to that. So I come here, I get laden with that 20-kilogram winter jacket of my mom-in-law, and I was then
Your mother-in-law.
taken to my new house now. So that was the first shock, the weather shock. After that, there was a lot of unlearning and relearning. So, unlearning of things that I would never have thought I would have to learn again, like using a zebra crossing for crossing the road. In India, we don't use zebra crossings. We just cross wherever we can. We'd sometimes stop the vehicles and cross the road. We're like headless chickens. We are the kings of the road. Pedestrians are the kings of the road. So you can cross anywhere. You don't need to wait for the vehicles to stop. But here, you were supposed to use a zebra crossing, plus you had to wait for the vehicle to stop. You couldn't just walk. You had to actually wait. Waiting and patience are two things we are not taught in India. No. So that was another shocker. And then the other shock was how quiet it was. So the place where we live, I could hear my heartbeat. I thought something was wrong with me. I could hear my heartbeat every. No, really. And you can ask my husband, he can confirm this. I was so daunted by this. I was like, why am I able? Is there something wrong with my ears? Do I have a tumor or something that's just amplifying the sound of my heartbeat? And I was looking at all kinds of medical disorders that I could be having because I could hear my heartbeat.
Hyperacusis.
I don't know. I have no fucking clue. But, I could hear my heartbeat and that was wrong. And in
Because
India,
the place was just dead quiet.
exactly. The place was dead quiet any time of the day. You don't hear people talking to each other. You don't hear the honking of the horns, which is something that is kind of lullaby to us in India. We can't sleep without hearing the honks. You can't hear the barking of the dogs. What is this? Like you can't sleep without hearing barking of the dogs. It's important. So I was trained to sleep in that kind of noisy background. That's my white noise. And it wasn't there anymore. So that was a shocker. But I think that eventually got replaced by my husband's arm, the left arm. So
Uh,
I was able to sleep. I'm still able to sleep because of that. But yeah, that was a shocker. The other thing was, I think this whole bit of going unemployed for a bit. So I'd never been unemployed for at least the past 10, 12 years. As soon as we got into med school, I thought we were employed. And then
Because it feels
suddenly,
like that, isn't it?
it
Only you're
does.
not paid.
And suddenly, my bank account's zero. I have to rely on the pocket money given by my husband. And I was very shocked. It was the first time that I had to actually budget things for myself. So it was a shocker. And then the fact that I had to clear so many roadblocks before I could actually land a job, despite having so much experience, despite having all the skills, and despite having, the motive and the desire to do things. It was a big roadblock. So I wasted about 6 months of my time just to get GMC registered. And how I filled those 6 months was really important because I didn't know where to go, whom to ask. My husband is not medical, so everything had to come from the internet. Everything had to be searched for. And I wasn't a very keen internet user either because all my life I'd just been looking at patients and dealing with medicine. So I didn't have the time to go on the internet and scroll and search in chat GPT
And
because
did you know? Well, there wasn't ChatGPT at that time anyway.
yeah.
So,
I mean,
but
there must have been something. Maybe there was something.
yes, did you not know anybody who had taken that route before?
Absolutely not. And I
Yeah.
didn't know who to go and ask.
Mm.
And nobody in my family had gone through that route. Nobody in my friends had gone through that route. Everybody was back in India doing their thing. So whatever they were doing post finishing their postgrad, they were doing that. They were working as consultants, and I was here unemployed, sitting in the house thinking what to do. So I think what helped at that time is getting a library membership in the BMA because my husband was working there in BMA. So then I used to accompany him and go there and sit in their library for a bit. And
And for the
there,
person who doesn't know what BMA is, what's BMA?
so it's British Medical Association, which has got like a really nice place in central London, Holborn, and they've got an excellent library there. And if you become a member, as an overseas member, you can actually use their services and their premises and, just go there, chit chat with people. Sometimes they also do little events. Like I attended one of their events, which was something related to GMC. I'm not sure. Welcome to the UK or something.
Mm-hmm.
And I think I got a few ideas from here and there while doing that commute to the BMA. And it also helped me get onto this BMJ thing, which is sort of a learning platform, an e-learning platform. And that was my first ever encounter with e-learning.
Wow.
So I made the most of it by going through all the e-learning modules that they had and just keeping on doing a little bit of a review on little bits and pieces that I thought were important for my job or eventually when I get a job. From there, then I also realized that there was something called a clinical attachment, which essentially at that time was thought to open doors to the NHS. It doesn't. It does not. If anybody's thinking of a clinical attachment today, I would say stop thinking about it. Don't waste your time. So I did that anyway because I had absolutely nothing else to do. So I just randomly emailed somebody and they agreed to get me an honorary 1 month placement in UCLH in the Jerry's department. And I was like, fine, how bad could it be? We'll go there, we'll do our things. I'll teach the baby doctors there how to, deal with patients and things, and I'll teach them a thing or two, and I'll come back. But it was nothing as I'd ever imagined. It was very daunting again because the culture is really different. The first shocker from the medical point of view came when so I was used to calling my seniors sir and madam, and many of my colleagues would still be calling them sir and madam. Whoever is coming from India, we've got a culture of even 1 year senior to you, you'd call them sir and madam, right? And I go there my first day, meet this person who's going to be my supervisor, and call him sir, and he holds my hand, takes me to a corner, and said, "Never ever call me sir. Call me by my first name." And this is like a 50-year-old guy. how can I call them by the first name? That was unimaginable for me. But that was another big shock for me, to try and call 50-year-olds by their first name. And it took me a while to get used to that, and now I'm calling everybody by their nicknames. But that was
Even worse.
that was a shocker. And then that 1 month clinical attachment was an absolute waste of time for me. Like, you were not allowed to do anything. You were not allowed to touch the patients. The least you could do was help the SHOs take history, but that history cannot go onto their electronic systems because it's been done by you. So you write it down in your notes, discuss it with the SHO, and if the SHO then likes your history, then they will pick up some points from your history and put them on the notes on whatever system they were using. So that was an absolute waste of time. But then from there, I picked up that for PLAB 2, they were doing some kind of a coaching course, and this was a thing at that time. I'm not sure if that's still a thing, but these coaching classes used to run intensive courses for 10-14 days, where they would teach you everything about passing PLAB 2. So I also then joined one of these courses, and I think that was a sigh of relief for me, because there were many more like me in that class. So I felt sort of a camaraderie with them, and we're like, okay, there are more people like me. Everybody's struggling. I'm not on my own. There are more people. So that was a little sigh of relief. And then we met quite a few people coming from Pakistan, India, Bangladesh, Sri Lanka. We made a little group of people who would study together. And again, because this was my bread and butter anyway. So I didn't have much trouble knowing things, doing things, taking histories, doing the little procedures on mannequins and dolls.
Mannequins.
Yeah, I mean, I call them dolls because they don't look like humans at all. So I was quite okay with it, and then I managed to pass my PLAB 2. And now I thought, after passing PLAB 2, this is it. Like, you get your GMC registration like really quickly, and then you can just go for a job. But I didn't know that GMC is so slow. That was another shocker. So in India, again, I keep on going back to India because just the time efficiency of things and the things that money can do for you. So in India, you'd hardly take a couple of days to get your registration through. So if you want a medical registration as a new graduate or as a postgraduate, all you need to do is give them an application, pay the fee, and within the next 3 or 4 days, you will get your registration approved by post if all your application stuff is okay. But in GMC, it took me another 3.5 months to get the registration go through. And this was despite giving them all the paperwork that they needed from me. But the whole processing time was ridiculous.
So tell me, what were you doing to fill your time? Were you just still going to the library?
Wasting it. I was wasting my time because it was now I'd reached the point where my patience was wearing off. So I'm like, I've done all the things that were supposed to be done. I've done PLAB 1. I've done a clinical attachment. I've done PLAB 2. Now all you need to do is just give me that registration so I can start working. So the first 2-3 months were really difficult for me. And after PLAB 2, it became even more difficult because now I knew the way through it, but it was just not happening. It was taking too long to happen. So I think I was very grumpy during that period. I was very grumpy, very angry with myself, with the system. I would just curse everybody. I would just, write random Facebook posts and try and vent on my husband. He was very patient throughout that time because he knew that this was going to happen. He had warned me about these things. I just didn't take it seriously before I got married because I was so much in love. Anyway, love is stupid. So, yes. But yeah, he had warned me that this is going to be difficult. It's not going to be a piece of cake. It's not quick. Everything takes time. But I just did not want to accept it. So, those 3 months were really difficult. I tried to get a BLS done, which was another 400 quids wasted because later I found I didn't need to do it. Then I think for a couple of months I was still trying to look for jobs. I had started the job search at least, because now the only thing I was waiting for was a GMC registration. So I applied for my first job, and luckily they asked me for an interview. So this was December of the same year as I came here, and I sat for the interview, and they said, "Well, as soon as your GMC registration comes through, you can start." So I started on the 1st of Feb next year. So this was
So what role were you going to take?
right. So that is another whole long story. Oh my God. So I didn't know where I was going to fit in the whole hierarchy of roles that they had. All I knew was there was something called a clinical fellow. Now, I didn't know whether I fitted into the junior clinical fellow or the senior clinical fellow. Again, I think I was being stupid that I was not going and asking people around of what these things mean. And I was just relying on instinct and my own understanding of things. I think
Because you
that is
were on
something
Facebook, so you
I
could
was,
have
but I
just.
wasn't I wasn't in the right groups. I was
Mm,
just doing really stupid things on Facebook. I wasn't really into finding groups and talking to the right people or meeting up people. And I had become very people averse by that time. UK creeps on you within the first 6 months. It makes you really antisocial. So I didn't want to go and talk to anybody. I had become really grumpy. I had become really antisocial, and I just wanted to be in my own cave at home and wait for an opportunity, which eventually came in. But then this was a clinical fellow job, and I thought I would get a registrar post. And that's what I interviewed for. And the interview actually went really well. And I was very pleased with how it went, and I thought they'd give me the right job. But I ended up working as an SHO instead of a registrar. They put me on a rota of 1 is to 16 or something in intensive care, but it wasn't a registrar rota. It was an SHO rota. And when I asked about it, they said, well, you're new to the system, so it'll be nice for you to first understand the system, get used to it, and then take a promotion. This is the exact words. And I fell for it because I think, like many of the fellow IMGs, I had completely lost my patience, and I was okay with any first job.
anything.
Exactly. I just wanted to work. I was feeling really de-skilled. I was feeling really useless at that point. So I just wanted to get my hands onto some ET tubes and shove them down people's throats. That's all I wanted. So I just took the first opportunity as it came, and I never questioned them anymore. I was like, fine, I'll take it. But this was with the background promise of actually, being promoted to a
But did you ask
registrar.
them how long do you had to work for before the promotion came, or you just took it?
I just took it. I just
Right.
took it. And I don't think it was a bad decision though,
Mm.
because that gave me an opportunity to get to know the system from the very scratch. And I think
Why
that
are you using the same words as me, Jing?
telepathic. So I think I got used to the system quite quickly. I was not very used to electronic documentation and things. I wasn't used to policies and rules and following, guidelines for everything. I wasn't used to nurses telling me to do things. So I think it was a whole new, learning for 6-8 months that again, as I said, there was a lot of unlearning before the learning actually happened. So I had to forfeit all the preconceptions that I had, that nurses can't shout on you, nurses have to clean up after you do the procedures. That was all in the past. Now here, the nurses would not do anything for you. You have to.
It sounds really humbling, your experience.
It has been. And I think that also gives me a very wide and broad perspective to how things are in the UK. And if I'm saying something about an IMG's experience, it comes from my own experience. It's not from the things that I've read or the things that I've seen or the things that I've heard. It's my own experience. So I'm very confident about telling things to people that they don't know about, because that's how the system is.
So you do have the lived experience there, because nowadays we see a consultant who has come from India, Pakistan, Nigeria, and on the first day he comes into the NHS and he's starting his job as an NHS consultant.
Yeah.
And in my heart, I really feel bad for them. I'm like, oh gosh, poor thing, it's gonna be hard.
And it is. Because I think some of my colleagues who recently came from India as locum consultants, who absolutely had no idea about the systems, about how it works, about the rules and regulations, and how cunning and how mean you sometimes have to be to just survive in the system, because they've not gone through that. You just plug somebody from a completely different system and put them here in a system they know nothing about, without even a proper induction. You ask them to shadow somebody for 5 days and then just get on with it. They cannot. They cannot survive it. They cannot thrive in that role.
And it's very little surprise then that they tend to have more complaints with such people. And then they are the ones who will be more likely to be reported to the GMC for misconduct and other things, just because they
But
don't know.
that's not something they are responsible for. I don't see how they are responsible for a systematic error, which then places them in that situation where they don't know the system, but they're expected to do exactly how the system asks them to do. So I find that very unfair. So some of my friends who have now left the UK, they worked here for a year or two, they just couldn't integrate into the system, and they were feeling really reprimanded all of the time. So they had to leave, they had to go back home. And these were some really skilled ICU clinicians, really highly skilled, who are respected highly in India, who had been working in senior consultant roles in the country, who have practically more knowledge than any of the consultants here at the same level. Superb confidence in their skills. So, I mean, losing somebody who's that skilled just because you couldn't provide the right conditions and the right working environment for them, and you couldn't help them integrate into the system, it's such a shame. It's such a loss for the NHS.
So now we are in the work field. Tell me, after your SHO, how did you rise through the ranks?
So I think after my first job, I then got a registrar job. The coming job was a registrar job. And then since then, I'd been a registrar. But then again, I had never had a job for more than 6 months. And this is something I probably subconsciously liked doing because I needed the break. It was it was a huge burning out experience when you had worked 6 months in an ICU as a registrar, doing 4 night shifts in a row, multiple weeks in a month. It was really, really exhausting, and it was taking a toll on my health and my mental state. So I promised myself that I wouldn't stick to a job for longer than 6 or 8 months, because I think that up to that time everything is nice, and then you start getting taken for granted, because now people know you, they know you're a hard worker, you will get more stuff to be done on yourself, and not many people will come to your aid because they would think that you know everything. So
Lubu,
yes.
tell me some of your highest. So if you can recall maybe one or two incidences that were like the really highlights of your junior, before you became a consultant, your experience as a junior doctor.
COVID was a very tough period, but also one of the highlights of my career as a registrar, because that was the time when a lot of things were, as a registrar, you were kind of facing the consultant every day. But during COVID, I think things changed quite a bit because the consultants were not that involved, and the registrars took a more leading position in ICUs. So I think that was one of the main experiences that improved my leadership skills in this country, at least. And the second one was when I realized that I had to do Caesar. So it took me a good 3-4 years to realize what my pathway to a consultant post would be, because I wasn't sure. I didn't want to go back into training, and people kept on pushing me to go back into training. I didn't want to, because I trained myself enough. I don't want to go through the whole process again. And it's not going to add anything to my skill or my career as a whole. I'm only going to do the same things that I've already done for so many years. So it was a waste of my time and energy. And I didn't want to go through that whole process. Also, I didn't want to leave my home and keep on rotating through different cities and different places. I wanted the comfort of my home. So then it took me a few years to realize that there was this alternative pathway that I could take. So in that time, when I was still trying to figure out the process, there was no help. There was nobody to tell me that you can take an alternative pathway. There was nobody to tell me that Caesar was possible. There was nobody to tell me how to do it or who to ask for help. It was horrible. And I had to suss it out myself, how to go about it. There are like a million pages in GMC website about Caesar, but nothing makes sense unless somebody tells you.
So who did you find to tell you?
So this was one of my registrar jobs in Brompton in London.
Mm-hmm.
And the appraiser there was a lady who also used to do locum consultant recruitments. And she saw my profile. She went through my CV during the appraisal and she pointed it out. She's like, oh my God, you've got so much experience. Why are you still working as a registrar? Why do you not want to become a consultant already? And I was like, well, I don't know how to. And she was like, just do Caesar. I was like, no, but you need 1,000 pages of evidence and everybody says it's very difficult. It's next to impossible, blah, 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 blah. And I don't want to do all the rotations again. And she was like, but even if you don't do Caesar, what do you think you're going to achieve in the next 5 years? Where do you see yourself? And I was like, well, if I don't do Caesar, I'll probably be doing the same job in the next 5 years. So she was like, if you're going to do the same job in the next 5 years, why not start collecting the evidence as you go through the jobs? Don't think that you want to do Caesar. Just keep on collecting evidence in the background of all the things that you are doing. She gave me a list. She shared a list of things that they look for in a locum consultant role. And that list stays with me. And that list sort of opened the first door of opportunity for me to then start collecting evidence for Caesar. She sat with me for a good 30 minutes. She didn't have to. She sat with me for a good 30 minutes, explained all the bits of evidence that I needed and how I could collect them and where from. And she ran me through the whole process. And suddenly I felt like I can do this. It's totally doable. Like in 5 years' time, who knows? I'll be a consultant. And here I am.
And all it took was just one person,
Just one
30
person.
minutes of their time
Yeah.
to get you to get here. Wow.
You just need that one right person who can give you the right advice. That's it. That's all you need. And that's why I'm so much into mentoring now, because I know there are people like me who have absolutely no idea how to go about things. And all they need is somebody to just give them a little push. Just tell them that it's doable. Go for it.
So you've managed to gather your evidence and now you are a consultant. In the gathering of the evidence, how easy was that process?
Again, it was quite difficult, to be honest. It's not as easy as it seems. But then again, if you know what to collect, and if you make it a habit to keep writing or collecting or documenting everything that you do, then it becomes really easy. So most of us, what we do is we do things. We do a lot of things in our day-to-day work, but we don't have the habit of documenting it. We don't
Yeah.
have the habit of reflecting on it. We don't have a habit of doing assessments regularly or asking somebody to observe us and do us a docs or
Yeah.
supervise us and do us a workplace based assessment.
Yeah.
So I think we procrastinate in that sense. And that's where things don't go well for people who want to collect evidence. So if you are a little bit more, up for it, and you keep on doing it consistently over a period of time, it's not that difficult. So I think
Right.
my changing point came in 2022 when I asked a couple of my own consultants whether I should take up a locum consultant job already or do my rotations first the specialist rotations that are needed for Caesar, and then take up a locum consultant job. And one of these consultants told me, who's a CCT consultant here in the UK, he said, see, if you take up a locum consultant job, once you move from that registrar post to a consultant post, then going back and doing rotations as a registrar becomes really difficult. Getting your assessment signed becomes really difficult. There will be some hesitation. Okay. So it's better you stay a registrar, finish your rotations, get your evidence, and then go for a locum consultant post. It's not that difficult. And I think that was also one of the best advice that anybody had given me at that point. So I was fearing these rotations, but they were not that bad. I did a 6 months in PICU. I needed only 3. And I absolutely hate children. Okay. It was the most difficult rotation that I had done with the kind of mentality that I had,
Mm.
but I absolutely enjoyed it. The 6 months were really, really good. And that PQ experience just opened up so many new avenues for me. Because then I met some people there who had done CSER, and they helped me through the evidence collection again. Once one door opens, I think the rest of them is just a stack one after another. It just keeps opening. So I think that was quite a good experience for me.
You mentioned about not doing work for more than 6 months because you didn't want to get burnt out.
Yeah.
For many international medical graduates, they may not have that luxury because they are on visas. I mean, thankfully you are a spouse, so your case was quite peculiar.
Yeah.
But for the average person who is a trainee on a visa, do
Yeah.
you have any ideas on what they can do to keep their well-being whilst they are in training or even after training?
I think most of us who come from other countries, we are very used to working in really stressful environments. And we are also very used to having a thick skin, which is something that gives us an edge over people here. So the trainees here, they're not very thick skinned. They've not seen the kind of politics, the kind of aggression from seniors that we all, go through during our med schools and during our work in the other countries. So I think that gives you an inbuilt resilience to many things. But then again, sometimes we just take it for granted that we are so resilient, we can do anything, we can keep on working without taking a break, we can do more than others. So, those kind of misconceptions, I would call them, they need to be broken when you're coming to this country and working here because it's a very different environment. You don't have the luxury of being with your family. You don't have the luxury of going out with your friends every now and then and, decanting with them, which is something we do on a regular basis in India. So I would be out and about after every shift, meeting my friends, having drinks, going out, having chats and tea and those kind of things. It was very common for us. In the UK, it's not that common. Making friends is really difficult. Breaking through cold people is really difficult. And the environment, the whole culture is quite averse to spontaneous meets and making friends and going out and enjoying your time and venting out. I think that's a big difference between other countries, tropical countries with sunshine, and UK with no sunshine and all rain.
Absolutely. You go to work if it's winter time, by the time you're going to work, it's dark.
Yeah,
By the time you close, it's dark and
exactly.
it's cold. I
Yeah,
mean, it's all gray. Even on the supposed sunny days, it's gray, it's wet.
yeah,
You don't want to go out on a day like
exactly.
that.
So where do you then find the respite from your long days at work? I think we need to, as IMGs, first realize the fact that despite being so resilient, very hardworking, diligent people, our bodies still need a break. Even if even if we need the money, even if we need all those things, there's still a possibility of giving our bodies a rest. There is still a possibility of taking those annual leaves. There is still a possibility of taking a sick off if you're not feeling like going to work. And that's okay. You don't need to feel guilty about it. This is another thing that most IMGs suffer from, this guilt of asking for sickness offs. I don't know what's wrong with our systems, our brains or something, but we are sort of primed not to ask for sickness offs and work through sicknesses. That's BS. We cannot work through sicknesses. We are putting our patients at risk if we're working through our own sickness. If you're not feeling like it, don't go to work. Just say no. Nobody's going to reprimand you for feeling sick. And this is something that is a mindset issue. We need to break through this. We need to stop feeling guilty about asking for sickness offs. Or even as a consultant, even now, sometimes when I'm sick and I want to ask for a sick off, I still feel that little triggering guilt.
Yeah,
Oh my God, what will happen to my patients? Oh my God, what will happen to the unit? Nothing will happen to your patients. The NHS will still work with or without you. You're all expendable.
absolutely. And one of the mantras that I have taken on is that dead men don't work. You know, no matter how much you think your work loves you or you love your work, they can't use a corpse at work. You need to be alive to be of use to them. So please don't come to work when you are not well. You are a hazard.
Yeah, and it doesn't make any sense. It's helping nobody. It's not helping yourself. If you are sick, just take that off. Even if you're not sick, there have been times where I was very, very exhausted after, say, 4 nights at work. I was very exhausted and I was supposed to do a long day after a break of 24 hours. But I was mentally not prepared to go for work. I was just feeling completely mentally exhausted. I couldn't think. I'd not eaten properly for days. I was physically exhausted. So I had to ask for a sick off because I didn't think I would be able to take those split second decisions in that state. So I had to ask
Absolutely.
for it. And
Yeah.
it's okay. I realized it's okay. I was a much better doctor after taking that sick off than if I would have gone on that day and worked.
I'm happy you've talked about this, about prioritizing our own well-being, and also emphasizing that it might not necessarily be you unwell. So for instance, if you have an unwell spouse or even you have a sick child, you know, nowadays a lot of the children do have like chronic diseases. Maybe you have a child with autism or ADHD, he hasn't slept all through the night. How are you leaving your child at home to come and take care of someone else's child?
And it's
You
not
know,
worth it, Hannah. It's just not worth it. I think at the end of it, and this I've realized after many, many years of, feeling really
guilty.
stuck and really guilty about things, that at the end of it, who is going to stand with you when you are not yourself? It's not the NHS, it's not your work colleagues, it's your family. It's your kids, your spouse, your parents, your siblings. They are the ones who are going to stand with you. Say you're not able to work at all. Who's going to stand with you? It's not going to be your work colleagues. It's not going to be the NHS. It's going to be
Your
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 family.
line manager.
Exactly. It's not going to be your line manager. He will go and find somebody else to work in your place.
And I always say,
It's
you
your
know what?
family.
Because you don't come to work, someone is going to be paid an escalated rate.
Exactly. So
So don't kill
they
yourself.
will find somebody to replace you. But your family cannot find anybody to replace you. You are the only person that they can look at. And you have to live for them. You can't be living for your work. I've been a workaholic, I would be really honest. I've been a workaholic all these years. And I've been having really bad times at work. Sometimes I bring it home. Sometimes I just rant and vent everything on my husband. But over the course of past few years, I've realized it just doesn't make anybody's life easier. You can't carry on like this. You have to take a step back, look at yourself, get your mental and physical well being sorted. Because it's not just you, your whole family suffers. If you're coming with that bad mood to home, to your kids, they are going to see you in that bad mood. And, their response. And over time, it will just build up. So you're not doing them any good. And you can't fake a smile in front of your kids. And I know that well because my parents used to do that in front of me. They would
Yeah.
have fought outside, then they would come inside and try and smile at me. Doesn't work. Kids are very, very intelligent in that
Intelligent.
respect. They can gauge things subconsciously. They know you much better than yourself. So you can't fake these things in front of them. If you're in a bad mood, they will pick it up.
Indeed, they will. And you don't want to raise traumatized children.
You want everything that's best for them, including a very good mentally satisfying environment to grow up in. And you don't want them to face your traumas at work. Just because you had a traumatic day, you don't want your kid to feel that trauma. You don't want them to suffer because of that. So I think it's
Absolutely.
it's, it's a best practice. Whatever day you've had at work, take some time off, vent it off somewhere where your kids are not there. Just go and scream at a river or a lake. Just write down in a diary, like really violently. Here's some papers, flush them out. Do something. Find your own way of venting. Once you vented and then you come home, you are a different person. And believe me, I mean, I've tried this so many times now. If I keep those things away from my home's a very happy place. You
Tell
can't
me a little bit,
in your work.
what does writing do for you?
I think writing is my way of self-expression. It's very, very important to me. And I didn't realize it until a few years because I used to write a lot anyway. I used to do journals. I used to write about my day, the routines and my work and my friends and everything that was happening in school. One of my teachers then pushed me into writing poetry. So I started writing poetry, little poems, then big poems, then rhyming poems, and all those things. So it kind of grew on me. Now I use writing as a form of self expression, it liberates me. So I write about everything. Earlier, I used to write about my feelings, the things that had been happening around me, my observations of people. Then I started writing poetry. Then I ended up publishing books on my poetry. Then I started writing about a lot of posts, a lot of movie reviews on Facebook and Instagram. And if you go through my Instagram or my Facebook, there was a period of time, I think between
I'm
20,
going to post that in the description. Is that okay?
and that's fine.
Yeah.
There was a period of time between 2015 to 2019 or 2020, I would say, where I was very aggressively posting on Facebook and Instagram. And it was anything and everything about things going on around me. So COVID
Mhm.
was a big trigger for me. And I used to write a lot. I used to post poems and lots of quotations and experiences at work and just trying to make people aware of what was going around.
Let me ask you this, Lubu. Are you a feminist? Coming from the line of family, your mom being an ONG consultant, your grandmom, your aunties, would you describe yourself as a feminist?
Believe in the word feminist for some reason. I find it really, it's a very dichotomizing word. I don't believe in manist or feminist. I don't want to. I think what I believe in is human beings
Mm.
as opposed to a male and a female. I don't really care if you're a male or a female. If you're a good person, that's enough for me. Coming from a family of really, really strong women, I would still not want to take away the fact that they're all ladies. They've got their soft points. They are very good at doing what they do. There are things that they're not good at doing. There are things that my dad's better at doing than my mom. And I give them full credit for it. So I don't like dichotomizing humans into, well, we are strong feminists because we can go and punch men. No, that's not feminism. Or I'm a feminist because I fight for the equality of women. You don't need to fight for the equality of women. Why would you want to fight for anybody else? You do your own thing. You fight for yourself, and that's enough. If every woman starts fighting for herself, then you would not need other people to fight for you. That's it. Then you don't need feminism. You don't need other people to stand for you because you need to stand for yourself as a human being. You need to stand against what's wrong. And that's about it. If you feel somebody is trying to undermine you or somebody is trying to take away your opportunities, you stand there and remind them that this is not yours to take. It's mine and mine only. So I wouldn't want to put myself as a feminist. No, I'm more of a tomboy. Yes, but yeah, not a feminist. That's too strong a word, and I don't want to be. I don't suppose I fit into that category.
We should all be humans together.
I think so, and I think for me, even humanity comes even ahead of God, ahead of religion, whatever other things are happening in the world. I think at the end of all of it, it's more important how you feel you've done to other people or for other people than what anything else has happened around you. I mean, that doesn't
I
make
mean,
any sense.
just like what Maya Angelou says, isn't it? That at the end of the day, it's how you make people feel
Yeah.
that is important. What's your rich life, Lubu?
My what?
Your rich life.
My rich life.
Yes.
What's a rich life?
What's your ideal life, If you had no fear in the world, what would you do?
I'm living my ideal life. I don't think
Hmm.
I need to change anything in it. I'm pretty much where I wanted myself to be.
Mhm.
I'm not somebody to run after materialistic pleasures. I'm happy being able to buy little useless things from Temu and Shane and then dump them at the end of it and never use them. And they all
Lubu, you're disgracing consultants. Don't do that.
no, I know, but I'm not an idealist at all. I
Mm.
am very spontaneous in that sense. I'm like, I'd be happy with anything and everything that comes my way, so long as it doesn't pisses me off. So yeah, I don't have any. I have dreams, yes. I have dreams of, being somebody who people can look up to, being a role model, or helping people out, teaching them things that I know, or growing a community of like-minded people and things like that. Just very random things. But I don't want to be like a billionaire at the end of it and have expensive cars and a big bungalow. I'm pretty happy in my two-room apartment. I think for me it's more about people. I don't think it's not about things. It's not about luxuries. It's more about the little things in life that you can just
Mm.
enjoy and go about doing.
And I asked two questions. The second one was that if you had no fear in this world, what would you do?
If I had no fear in the world, I would potentially. What would I do? That's a
Apart
very.
from sacking your boss.
So I wouldn't sack him. He's okay. He's not too bad. I wouldn't want to sack anybody. I think if I had no fear in the world, I would just try and make everything available for everyone. It's like the world's a very unfair place. Some people have everything, some people have nothing. If there was no fear of people coming and killing me, I would just go on and distribute things to everybody, like equally, like everybody be equal, you know, don't have anything.
So would you be like a Robin Hood? You would steal from the rich and give to the poor.
Steal, I'll just make them give away their
Right.
things
Okay.
because I don't
So
have any
now,
fear.
so now I'm having this little girl vibe. It's like a fairy. She has a little wand, and then once she
Yeah, you
she
just you just make them give things out, like sometimes you just tell them and they do it for you. Something like that. Maybe a little superhero vibe or something. I don't know.
Right. I'm going to give you a hypothetical question, Libu. I have just passed my club 2 and I'm starting my first job as an SHO in the UK. What advice would you give me?
So I think as an IMG starting your first job as an SHO in the UK, my first piece of advice is never be afraid to ask for help. I think we take this for granted that people will come and help you, but they will not unless you ask for it. It's always a give and take. Nobody's going to just imagine that you are suffering unless you go and tell them. So you have to be really honest with people. If you are struggling, tell them. Don't fear that they will judge you because people will judge you anyway. But if that judging helps you in any way, then I think it's better to go and tell them that you're struggling and how tell them how they can help you, is my advice to IMGs. The second piece of advice is, if you are skilled enough, then be bold enough to use those skills and try and get promoted. Because many of us, we underestimate ourselves. Back home, our training is quite intensive. We are very highly skilled by the time we reach here. And some of us really get de-skilled because we don't give it enough credit. So I think if you've got the skills, don't be afraid to show it off. Don't be afraid to take your credit for doing things for people. Unless you tell them what you've done, nobody will know. So you have to be really straightforward and
Assertive.
outgoing, assertive, yes. And never be afraid to ask for help. Nobody's going to chew you out. I find people here, trainees here, are quite helpful and very kind. It's just about asking them in a nice way. So don't forget your please and your sorries. I think that helps.
And wow, Lube, I have thoroughly enjoyed our conversation. Even the ones that I try to put you on the spot, you being vulnerable, sharing your love story with us, and more importantly, sparing some of your holiday time
Oh,
to
it's all right.
come on and tell us. I mean, have this chat. I have thoroughly enjoyed it. Thank you so much. So, guys, I would be leaving her Facebook, Instagram, and she's recently rebirthed on LinkedIn. So please do follow her, and you'll be interested in her use of AI to generate her images. I'm so impressed with your IT savviness, you know.
Really? Oh my God.
Yeah.
But
Well,
AI just messes up things sometimes really bad. It's not good for everything. But
no,
yeah,
it's not.
it'll get
It's
better.
not. It won't get there. Yes, someday. So until we meet again, same time next week, I would say bye for now.